journey started on this campus. Got sober as a client here, just like you.
I really do see phenomenal change.
Always hope. I've seen situations that on the surface look impossible become possible.
Doing this podcast is to share those recovery stories, be honest about what the challenges are, and have some real conversations, but kind of share that out on the airwaves.
Welcome, everybody, into another episode of Airing Addiction. So glad you're here. No matter what brought you to click on this episode, if you're in recovery or if you just stumbled upon this, someone told you about it. Really glad that you're here. We have a great show for you today. I'm going to turn it over to Lisa to introduce our guest.
Thanks so much, Jesse. So for those of you that are on the East Coast, it's very chilly. Our guest today is on the West Coast, so much less chilly. And so hence why we've adjusted our regular kind of live hours to accommodate the time zone change. But we're really excited. And this, I think, is really a fantastic topic that I've been diving a bit into myself for the past several months, as well as our organization at Spectrum. But we're really happy to have Dr. Eric Garland with us today. And so Dr. Garland is one of the foremost researchers in mindfulness-based interventions for addiction, pain, and stress. We're going to hear a lot more from Dr. Garland about that, but he brings over 20 years of experience providing mindfulness-based therapy. He's the Distinguished Professor and Associate Dean for Research at the University of Utah College School of Social Work, where he directs the Center on Mindfulness and Integrative Health Intervention Development. But what we really are going to talk mostly about today, and I'd love to hear how you get to this work, but is the work that Dr. Garland has done to develop mindfulness-oriented recovery enhancement. The acronym there is MORE, so you'll see that in his background if you are watching that on our YouTube channel or watching live on Facebook. But this is an innovative evidence-based clinical intervention that integrates mindfulness training, cognitive behavioral therapy, and principles of positive psychology to support individuals who are struggling with addiction, emotional distress, chronic pain, and opioid use disorder. And Spectrum is actually part of these studies now, but it's been tested in multiple NIH-funded clinical trials, really demonstrating really some very impressive effectiveness. And so I won't give too much more because that's what our conversation is going to be about today. But we're really happy to have you on the Airing Addiction podcast, which reaches kind of far beyond our treatment programs and far beyond our area, but also very excited to be part of Empower, which is a statewide research initiative with opioid treatment programs. So for those of you who aren't familiar, Spectrum runs 14 opioid treatment programs across the state of Massachusetts, and we're really taking a statewide approach at integrating this model and seeing how it can positively impact our own patients. So with that, I'd love to hear from you, Dr. Garland, about how did you become interested in this space of mindfulness? Like, what has been your kind of career trajectory that landed you in this place of developing this clinical support?
Yeah, great question, and thanks for having me, Lisa. My journey with mindfulness really started when I was pretty young, and I started practicing mindfulness on my own around the age of 18. And it really, from the very first time that I did it, it just was completely transformative. I just kind of immediately gelled with it, and I knew that it was going to be one of the most important parts of my life. And actually, I think relevant to your listeners, I was certainly running with people at the time who were using drugs and alcohol pretty extensively. And I knew, and some of them actually ended up kind of falling by the wayside and going into addiction. I think mindfulness was probably one of the things that protected me from not falling into addiction. And I think that's because early on I realized that instead of turning to a substance to make myself feel better, to reduce stress and to manage my mood when I was upset, I learned that I had this inner resource that I could draw on through mindfulness as a way to create well-being. And so I became really passionate about mindfulness meditation. I was studying, along with psychology, I was studying religion and philosophy as an undergrad, and I became very steeped in Buddhism and Hinduism and Taoism, as well as the mystical branches of Judaism and Christianity and Islam. And I was actually aiming to get my PhD in philosophy and religion. And fortunately, I got rejected from every one of those PhD programs. And I say fortunate because I would have lived a life of abject poverty had I had I got my PhD in religion. So instead, I went down the clinical path, and I started doing clinical work, and was training to be a psychotherapist. And then it was just a string of kind of serendipities that happened that led me into this work. So I got trained in hypnosis because it was the closest thing that I could find in Western medicine and healthcare that was like mindfulness meditation at the time. Because at this time in the early 2000s, mindfulness was not what it is today. I mean, today it's everywhere. You know, it's on magazines at the checkout stand in the supermarket. But in the early 2000s, people just weren't talking about it, and it wasn't a part of healthcare. So I'm going to tell you this story. It's kind of long and rambling, but maybe people will find it interesting. I went to get my PhD to study hypnosis, and I moved my wife and my baby to a brand new house, my first house, and got there. And the day that I moved into the house, I got a phone call from my PhD advisor, and he said, "Eric, I'm sorry, but I can't work with you anymore. I can't take on a student. My grants have run out, and I just got to do fundraising, so I can't help you." And I was just devastated, man. I just cried all night. You know, I just moved across into a new state to do this, and um, and then I woke up in the morning, and he called me and he said, "You know, I can't help you, but by chance, would you be interested in studying mindfulness?" And I said, "Mindfulness? People study mindfulness?" and and 20 years of my career unfolded from that moment. So I was as I started developing, so I started working as a therapist in an integrated medicine clinic alongside physicians and nurses, and I was the head shrinker guy. Uh, and they would send me their toughest cases, people who had really complex intersecting medical conditions, psychiatric disorders, and addictions, and a whole lot of chronic pain. And they really, these are the folks that they didn't know how to help. Um, so I tried to help them, and to do that, started developing this approach of weaving mindfulness into psychotherapy, into my cognitive behavioral therapy practice. And that was the beginning of more. That was the living laboratory that more came from. Um, So I did the first study of more, um, which was for people with alcohol use disorder, and a lot of them also had co-occurring cocaine use disorder. These were folks from the inner city. They had lived really tough lives, had a lot of trauma and exposure to violence. And we did the first study of more in this population. These were folks in long-term therapeutic community in the Southeast U.S. And we found remarkably that more was actually reducing how much patients were getting triggered. So we did this physiological protocol where we showed these people were alcoholics. We showed them alcohol cues. So we showed them photographs of whiskey and beers and their favorite drinks, and measured their heart rate response to those cues. And we found that after 8 weeks of the more therapy, patients' heart rate bounced back quicker after being triggered in the lab. And so we thought, hey, maybe this thing actually might work. Um, but then it was around 2010 when I started my first academic position as a professor, and I was trying to figure out what to do with my life. I bumped into a physician, and he said, "Wait a second, you've been using mindfulness to treat pain and people with these complex uh, medical and substance use problems, but you doing research on mindfulness as a treatment for addiction?" he said, well, this is Florida in 2010. This is the pain pill mill capital of the USA. We've got a big problem with people who are dependent on opioids here, and we don't know how to help them. I've got patients in my clinic who've been taking opioids for more than 10 years, and they have a problem, but they just don't know how to get off. Maybe you could help them. And that was the springboard for the next 15 years and $90 million in research funding to develop and test this therapy. That's how I
Well,
got
Dr. Garland, I can say that I've gone over your website, and certainly it'll be in the show notes for anybody that's listening and interested. Just a wealth of research and options, and I'm proud to be associated with Spectrum. As Lisa said, we're also part of that in the more treatment. Obviously, mindfulness is something that we speak of every day. Myself, as a licensed mental health clinician, as somebody in recovery who practices mindfulness, but I'm just thinking of the people who are listening now that maybe they do see that mindfulness in the checkout aisle at the magazine, and not really understand what that is. If you could just speak to that about what specifically mindfulness is and how you incorporate that in your more treatment.
Absolutely. So mindfulness is a mental training practice that involves uh, cultivating awareness and acceptance of your thoughts, your emotions, and your body sensations in the present moment, and observing these experiences as if you were a witness to your own experience, as if you were an objective observer. So the way we do mindfulness training is we do specific mental training exercises that are forms of meditation where we focus attention on an object in the present moment. And it really could be any object, but we typically begin by teaching people to focus on the sensation of their breath moving into their nostrils. And so what you do is you focus on the sensation of the breath moving into your nostrils. And then if you're like most people, after 10 or 20 seconds, your mind's going to start to wander. And then all you do is you just notice where your mind has wandered off to, and you acknowledge and you accept that thought or that feeling or wherever the mind is going in the moment. And then you let it go and you bring your attention right back to the object of mindfulness, right back to your breath. And so what you're really doing there is you're doing this loop. We call this the loop of mindfulness. And each time that you do the loop of mindfulness, you're actually making your mind stronger, and you're strengthening the brain's capacity for focusing attention and regulating your behavior. And the more times you go through this loop, you're starting to develop this awareness of yourself and how the mind is working in reaction to the world. And so you begin to develop this awareness called meta awareness, which is really one of the most important parts of mindfulness. It's really all about knowing yourself and seeing who you truly are.
That's great. I always love the kind of simple example, like the description that John Kabat-Zinn gives of mindfulness, right? Of just, paying attention on purpose in a particular way, non-judgmentally, right? In order to really gain wisdom, right? Like, so I think, people think it's, a really kind of unattainable or, something that you kind of have to get to like, a specific state. And really it's, paying attention to exactly what's happening already with you, right? Whether it's your how your body feels, what thoughts you're having, what's happening in the moment. And, the real applicability to that for folks with substance use is that you get so disconnected from what you're feeling in the moment, and so disconnected from how your body feels, and so disconnected from all of that, that it really brings some space before choice in a lot of ways. And one of the questions I actually had for you, Jesse, is I was hearing Dr. Garland talk about kind of the evolution of this and the work and doing this work in therapeutic communities. And Jesse has direct experience in Spectrum's own modified therapeutic community, long-term residential. Like, what do you think that, and we weren't integrating these kinds of things then, right? And we do a lot more of it now. We have more mindfulness curriculum. We're, embarking on this work with Dr. Garland. It's more part of the work that our clinical staff do. But even though it wasn't that long ago, Jesse, that you were with us, I have to imagine that these concepts weren't discussed in the therapeutic community you were in.
Correct. You are correct, Lisa. So, uh, Dr. Garland, as it's been gone over on the podcast here, not only am I an employee at Spectrum for the past 8 years, but I also went through 8 months of back then the therapeutic community residential program, co-ed with about 65 other individuals. And yeah, mindfulness was not, this was 2010, 2011. Mindfulness was just not incorporated as much as it is now, or if at all. I honestly think one clinician ran a group um, about Buddhism, and we did a guided meditation. But other than that, it was your typical CBT relapse prevention groups, which were all well and good. However, I look back now and think how much more the mindfulness, especially just being in an environment with so many people and not knowing how to, like you said, Dr. Garland, just really strengthen your mind to get back into that loop, right? And how to regulate emotions. So grateful for that one clinician that stood out there and was like, "Hey, we're gonna do this guided meditation." And all these years later, guided meditation is a regular practice of my own mindfulness and something that I speak of in sessions. Um, but just to kick it back to you, Dr. Garland, if you could speak more to more. I didn't even mean to do that, but just about what you found that's worked and has been researched and so thoroughly gone over. Yeah,
Yeah,
love
I'd
to
love
hear.
to. Love to. Yeah. And to be clear, more is more than mindfulness. Mindfulness is the foundation of more. That's why it's called mindfulness-oriented recovery enhancement. But more is really a breakthrough evidence-based mind body therapy that is rooted in ancient wisdom, but also rooted in modern neuroscience. And it's designed to simultaneously address addictive behavior, emotional distress, and chronic pain. And so more has been tested in over 16 clinical trials involving more than 2,500 patients. And so we know a lot about how this therapy works. There's been more than $90 million in grants from the NIH and Department of Defense to study this therapy. We know that more reduces uh, relapse by 42%. We know that if you add more to standard addictions treatment, it reduces dropout by 59%. More improves adherence on medications for opioid use disorder. More cuts opioid misuse by 45%, nearly tripling the effect of standard group therapy. And more decreases craving as well. Cuts the intensity of craving by about 50%. We also know that more treats the comorbidities, the co-occurring disorders and problems that often drive addiction. So more reduces chronic pain uh, by about 25%. And those effects last 9 months after the end of the 8-week therapy. And more has powerful antidepressant effects and also treats PTSD symptoms as well. So more is really a broad spectrum treatment that not only addresses the addiction, but it also addresses the pain and the mental health problems that often drive addiction. And so, what makes more so effective is it combines mindfulness or infuses mindfulness into skills from CBT and positive psychology, and in particular integrates mindfulness with reappraisal, which is the practice of challenging and changing negative thought patterns to reduce self-destructive behavior. And more also infuses mindfulness into a skill that we call savoring, which is focusing your attention on what is pleasant, beautiful, and good in life, and actually using mindfulness to appreciate and increase healthy, positive feelings of pleasure, joy, and meaning in life. And I think that last component of savoring is incredibly important. And actually, the science shows that it's incredibly important for helping to heal the brain's reward system that becomes uh, messed up in addiction. So, just to elaborate on that last point a little bit more, so we know that as a person becomes more and more addicted, there are changes that happen in the brain so that the brain becomes more sensitive to stress and pain and drug related cues, but the brain becomes less sensitive to natural, healthy pleasure, joy, and meaning in life. So the person finds themselves in a hole. They just feel empty inside, and they're always kind of trying to scramble to fill the emptiness, just to preserve a basic sense of well being. But it's a vicious cycle because the more drugs they take, the more the brain's reward system gets messed up, and the hole gets dug even deeper. So, but Moore actually aims to reverse this process by teaching patients how to use mindfulness to savor natural, healthy pleasure, joy, and meaning in life. This actually increases the brain's responsiveness to natural, healthy pleasure. It helps people to reclaim that sense of joy in life. And that actually decreases craving and addictive behavior. So I think that's one of the things that makes Moore such a big revolution in addictions treatment.
And that really, I, went through the training myself. And so that is definitely one of the things that stands out to me, right? Is two things about the model that I think is really supportive is like that really, what we're starting to do as a field is apply neuroscience to things we already knew, right? So applying neuroscience to prove things that already existed in ancient wisdom is really cool, right? So things that people did for centuries, right? Because they knew that it had positive impacts, we can now prove that it has positive impacts. And I think the progress, and we've talked about this on this podcast several times, we've made in the field of neuroscience and really applying that to behavioral health, to mental health and addiction is really important because it not only says kind of here's why this is hard, right? Here's why this is difficult. Here's why it's difficult to not have that cycle of return to use and not have those cravings interfere and not have that continued pattern. That there's not something wrong with you as a person, but that this is really what happens in the brain, right? And the idea of neuroplasticity that we can actually change that,
That's
right?
right.
So you are not stuck in this space of not being able to enjoy things you used to, or not, and depending on when you started actively using, never developing that joy in the first place for a lot of things, right? And in a lot of the clinical work that we do in addiction treatment is focused on kind of building a life without substances. And then people can get really frustrated with how hard that is. Why don't I enjoy this sport or this, a thing like other people seem to be enjoying it? And this gives some science reasons why that's hard. But I love that this curriculum also gives skills to actually make that change in the brain, right? So those savor skills of actually practicing savoring things can rewire my therapist speak, right? Because I'm not a neuroscientist in any way. I always give that caveat to patients and everyone, is that like it lets us rewire that part of our brain so that we're not stuck, so that we can change, so that we can enjoy things. We've had some, and I think one of our future guests will be coming on too to talk about some more parenting, but we've talked a lot about, I think we had Dr. Jessica Griffin on talking about parenting in the context of addiction and recovery and how the same kind of pathways are really hard to be a parent. Like parenting's awful. Jesse, you're in the thick of it now. I know Dr.
Thanks for
Garland, you are
reminding me.
too. Like that, like it's not inherently rewarding sometimes to change diapers and deal with screaming children and meltdowns and tantrums. But then the reward comes from all of the wonderful things that kids can bring us, their smile, their smell, like all of those things. But that in the context of what happens to your brain in addiction, it's more difficult to grab hold of that joy, right? And so then you think there's something wrong with me, like I must be a horrible person, a horrible parent, like, and really that's not true, right? Like that it's the impact of the substances on your brain that make that more difficult, and that can change. Like I just think that really resonated with me.
Absolutely. I think that's such a key message in all of this. You just, I think this is where one of the places where sort of the common kind of behavioral therapies that we use in treatment fail people. So the idea is, hey, if we can just encourage people, motivate people to do positive things in their life that they're going to feel good. Uh, and so you could really try to support somebody to start building a life without drugs and do positive activities in their community, or like you said, sports, or pick up hobbies, or spend more time with their family. But if they're still coming, if they're just merging into recovery, the brain just can't feel good.
Yeah.
It's lost that ability because the drug has stolen it. And so it's not their fault. Not, as you said, it's not that they're a bad parent or that they don't care about about having a better life. It's that it's really hard to feel that sense of pleasure because the brain's reward system has become hijacked. But I think the hopeful note is that we have really strong data that shows that if you go through 8 weeks of more, where you're actually practicing the skill of using mindfulness to focus your mind on positive life activities and to really appreciate the good things about those activities. So to focus your attention on the pleasant things that you see, the pleasant things that you hear, the pleasant things that you smell or that you touch or that you taste, and to begin to start to become aware of positive feelings in the mind and the body, even if they're just really small little glimmers of feeling good again. And then turning your attention inward to savor that positive inner feeling, to allow it to build and grow stronger. And you're practicing this skill on a daily basis. I think of it sort of like weightlifting for your brain's reward system, that you can actually build the muscle of the reward system again. You can build it back, and that this isn't just some therapist gobbledygook, but we actually have hardcore neuroscience data that shows that after 8 weeks of training, the brain becomes more sensitive to natural healthy pleasure again. And the more sensitive the brain becomes to natural healthy pleasure, the less patients crave drugs and the less they use drugs. So that, I think that's just really pretty revolutionary.
And it's certainly something that's been well gone over. What I'm about to say, that I don't think I came up with it by any means, but for as much negative impacts of drugs and alcohol use disorder, um, there's there's benefits, right? Maladaptive coping skills, if you will. So for everyone that is involved in that, it could be very easy to say that drugs and alcohol are the problem, but to switch that view and talk about them as the solution, and whatever's going on in life or in our brain is the problem, and that's our best solution at the time, right? That seemed to make a little bit more sense to me when I first came into recovery. And then what I just heard you say about, again, finding your solution, savoring those natural healthy pleasures. And now that at least I heard you say that, things that people have practiced for hundreds and thousands of years now, we have the actual raw data to back it up that these things work. Um, and it's like, tar I don't know why I came up with this, but Tarzan swinging from one rope to another, right? We let go of that old way of thinking once we grasp onto something else, and that takes us along the way. So, um, savoring was just an interesting word to me. I hadn't heard that used in any terms of addiction or recovery research. I'm just wondering how you came up with that term, or what led you to that piece of the more treatment.
Yeah, I'd love to talk about that. And let's put a pin in that other comment you made about that uh, the the drug use was a solution to a problem that served a function. So, and more deals with that part of addiction too, which is really important. But, but before we pivot to that, so where did savoring come from and more? You're right, it doesn't show up in addiction treatment. I think this is something totally new and novel for addiction treatment. And again, that's why I think more is such a breakthrough. So, to be honest with you, where it came from initially was, this is going to sound kind of funny, but it came from my mom. To tell you the truth.
I love it.
My mom was the best saver I ever knew. She taught me how to do it. She would. I remember, she loved being at the beach, and when she would go to the beach, she would stand by the water and she would close her eyes and she would just breathe deeply of the air and look out at the waves. Didn't have to do anything at all. There was this was before cell phones. There was no distraction. She wasn't doing anything. She wasn't talking to anybody. She just stood there and felt the coolness of the air and the moisture, and closed her eyes and took it in, and was in heaven. She would sit out on our deck at night, sometimes in the full moon, and she called it taking a moon bath. And she would just sit there in the moonlight with nothing, no phone, no book, no company, just sit there with her eyes closed, and letting the radiance of the moonlight fall on her body, and she was at total peace. So I think she was the inspiration for a lot of this, but where it really came from was studying the neuroscience of addiction and understanding that one of the core problems in addiction is, as I described to you, that as the person becomes more and more addicted, the brain becomes less sensitive to natural, healthy pleasure. And so that drives the person to try to find ways to make themselves feel good. And so the way they do that, the way they fill that hole, is they take more and more drugs, which just digs the hole deeper. And so seeing that cycle, which has been so clearly demonstrated for decades in neuroscience, it seemed to me like, well, we got to fix this problem. This is one of the key problems. We have to fix it, and people need a skill that can do this, because, quite frankly, there's no drug or medication that can heal this problem in the brain's reward system. Not one that's been developed yet. And so the solution, I think, is really a solution about regaining this skill, teaching yourself the skill. And like Lisa said, some people maybe never had the skill to begin with in life, because I don't know about you guys, but nobody ever taught me how to make myself feel good naturally. Did they ever teach you that in school, in elementary school or high school? Nobody ever taught that to me, right? So, and maybe we should be teaching our kids that, because without teaching them that, what do? They, they want fancier clothes. They want a new phone. They want more likes on Facebook. They're always wanting something else, right? In order to
Right.
feel good, rather than actually learning how to feel good with what they have right now and appreciating the simple things in life around them. Instead, we start to learn, seek more and more and more and more, and nothing ever is good enough, right? So what happens, I think, neurobiologically, is that you're always seeking that dopamine high from something in life, uh, to make yourself feel good. And so you need higher and higher, more and more intense forms of stimulation, right? So you need a fancier car, you need a bigger house, you need a more elaborate vacation, you need more likes on Facebook. And then, you take that vacation, and the next year's vacation has to be even bigger and better, right? And so what's happening in the brain is that the brain's reward system just gets flabby. It gets out of shape, right? It doesn't learn how to satisfy itself with the simple things in life, and instead it starts to crave these higher and higher, more intense forms of stimulation. So what we're really talking about here is reclaiming this basic ability to appreciate the good in our lives, and to feel content from it, and to make ourselves feel good naturally. And if we can use these skills of mindfulness and reappraisal and savoring to make ourselves feel good naturally, then maybe we don't need to seek a drug outside of ourselves to make ourselves feel good. Instead, we have our own inner resource for well-being.
And there's got to be something to giving those skills earlier in recovery. And so, Jesse, I know you spend a lot of time in recovery spaces, and one of the things that we consistently have historically reinforced is just go to more meetings, just do more, show up. And I think there's some real evidence around community, right? And we do lots of peer recovery episodes. We had a whole compilation of them, and I think that that's true, right? And we had Dr. Cora Vissant on from the Recovery Research Institute talking about peer recovery kind of reducing that time to satisfaction and happiness by 5 years sooner than without that peer recovery. And I think this is similar in that way. Like, if we can build those skills, you don't have to wait out the length of time, because in some ways I think that structure that has existed in kind of addiction recovery for a long time, of intensity and how long you need to go until you feel better. It's uncomfortable. I don't know if you want to speak to that, Jesse, but like it's a long, uncomfortable time, and we just support people through that, because over time then you probably have more capacity to shift your brain in different ways, right, with length of time. But if we can shorten that and get folks feeling better sooner by developing those skills, there is a portion of people who don't make it that long, right? So who don't wait out that really long, uncomfortable early recovery period. And and that's because it's uncomfortable, it's hard. And there's things that do contribute to it, post-acute withdrawal. There's lots of things that contribute to it. But I want to believe that some of it is this, right? Some of it is like this isn't fun yet. Like I'm not enjoying myself in any way. Like I'm not getting any benefit. I'm just no longer getting the benefit that I was getting from substances, right? And I'm just pushing through that. If we can start to replace that differently, that we might actually see some better outcomes with folks like that. I think that's why, in some ways, and you could speak to it more than I can, but it speaks to me why that would help with dropout of treatment, like why that would help with retention, why that would help with adherence, like in some ways it's because you feel better.
Yeah, great point, Lisa. And two things that resonated with me out of that, two different points. I'm reminded of the recovery saying, bring the body and the mind will follow, especially with what we're talking about here today in this episode, where I was taught early on that I'm not going to feel okay. I'm going to feel uncomfortable. I'm not going to, my brain is healing. So I'm not going to get the same joy or pleasure out of a sunset or looking up at the, moon, if you will. I have a very vivid memory of being at that therapeutic community. And for the first time really in my life, noticing the moon and the stars on a starlit night and wondering, like, who put those there? When did that happen?
Where have those been?
Yeah, where have those been? Right. And also, and I thought you were going to say the word, Dr. Garland, and maybe if I thought about just asking a question and get it out of you, but the word we always talk about here in this podcast, hope.
Yeah.
Having hope that, with the more treatment, with, addiction medicine, with community, that you're going to run into an intersection of people in communities and places that say, hey, I've been in your shoes. I don't know exactly how you feel, but I remember what it was like for me. One of the greatest joys that I get to do is I actually get to go back to jail. I get to bring in a recovery meeting to an institution that I used to not be allowed to leave. And I talk to those men about what recovery means in my life today. And there's other people that share their stories. And for as much as it's personally satisfying for me, I know that I can relate to that other person because I literally sat in that chow hall. I sat on those uncomfortable stainless steel seats in those jumpsuits. And I remember what that was like for me, right? So the hope that hopefully I bring into them, the same hope that I got when people did the same thing for me, came in and said things like, it doesn't have to be like this forever. There's another way. And at first, I'll be honest, I sat in that therapeutic community and didn't believe them and really tried to. I remember looking out the window one day at some people who were coming in to share their stories, and I wanted to catch them in the act of something. I thought that it was a big elaborate ruse, and I wanted to see, like, what they were really like when they weren't in front of us. And turns out they were just the same people. They were just there doing the same thing that I did, now that I do, right? So the hope that this is giving, to, I guess, wind down this long-winded point of, we can shorten that period of uncomfortability and get to the point where we can savor, whether it's a starlit night or, just the practice. I love positive psychology, and I love gratitude. And I send a gratitude list to somebody every day, and he sends me sends me his every day. And, when that hits, it's like a hit of natural dopamine for me. So
Totally.
I would love to hear from you, Dr. Garland. what's giving you hope? What's giving you hope in terms of treatment, or what you're seeing as the next um, the next big thing, or where do we go from here?
Yeah, great question. And to respond to that last comment about gratitude, I recently had the fortune of getting interviewed by Sanjay Gupta on CNN about this work. And as he learned about the work and actually started practicing some of the more skills himself, he said savoring is like turbo boosting your gratitude. And I agree, because gratitude is a beautiful thing. But gratitude is sort of this cognitive thing. It's this mental thing, right? You're thinking about the things in your life, and then you're telling yourself in your own mind, "I'm so grateful for my children. I'm so grateful for my family. I'm so grateful for uh, my friends, things that I care about in my life." And that's a really great practice. But savoring takes it even so much deeper, because instead of it just being this list in your head that you're noting the things you care about, you're actually using mindfulness to focus on the good parts of your life in the present moment, so that you can actually uh, take in the good. You can actually take it in and breathe it inside of yourself, and allow it to fill yourself up from the inside, and really feel it in an embodied way. And I think that's what makes it so powerful. And so I think Lisa's point about early recovery, and that it doesn't feel good, and so some people may drop out, it makes it hard for them to stick with it. I think that's one of the key things that Moore does so well, is that Moore is teaching skills in every session to try to help the person to feel good in that moment. And that's really pretty different than a lot of our traditional therapies, right? In traditional therapies, a lot of times people are sitting around talking about their problems. They're talking about how they feel bad. Oftentimes, therapists ask them about their past, and the painful things that happened to them in their past traumas, their unsatisfying relationships, and uh, and that's pretty heavy stuff, right? Um, And Moore does something very different. Moore actually teaches people how to feel good in the present moment, and to focus on feeling good, and to actually amplify that. And so, very early on in the therapy, people are reporting feeling calmer, feeling more peaceful, feeling feelings of joy or contentment or happiness, and that kind of ability to make yourself feel good naturally probably motivates people to stick with therapy. And that's probably why we find that if you add more to standard addictions treatment, that it reduces dropout by a whole lot, by 59%. So it's probably because we're teaching people early on that, hey, there is this way to create some positive feelings to navigate recovery. But I do want to go back to that original point you raised, Jesse, about that, people don't get addicted in a vacuum, right? They're using the drugs to solve a problem. That the drugs, they serve a function, because bottom line is, initially they work pretty well at relieving pain, whether it's physical pain or whether it's emotional pain, like the pain of depression or anxiety or anger or shame or PTSD. You take that drug, and initially it all goes away. And so it's solving this problem. And that's what makes it so sticky, because it works. And because it works, that causes reinforcement in the brain. And so it starts to strengthen the habit of using drugs, so that the next time that painful feeling comes up in your mind or your body, you're more likely to reach out for that drug again, and you take it, and it works, and it relieves that pain, and then it makes the habit even stronger. But it's a real insidious process, because the more times you go through that cycle, there are changes that are happening in the brain that actually make the brain more sensitive to stress and pain. You may not realize it, but you just start to feel moodier, uh, harder to control your emotions. You fly off the handle easier. You find yourself easily frustrated. You get really frazzled. Your nerves are fried and on end. You get anxiety, bouts of anxiety. You might have panic attacks. And that's all because the drug is changing the circuitry deep in the brain and the limbic system, like the amygdala. It's becoming hyperactive. And so more is not just teaching savoring. It's also teaching people how to directly alleviate physical and emotional pain. And that's really important because you have to give people a way to make them you have to give people a way to relieve their pain and suffering, in addition to giving them something that will make them feel good and bring joy back into their life. So more just both of these things at the same time. So we're teaching mindfulness skills to help patients to learn how to calm down the mind when they're stressed, how to become aware of negative thought patterns. And then we're teaching reappraisal skills to help people to actually challenge and change those negative thought patterns, to reframe the stressors in their life and to begin to see that that they do have inner strength, and that that the hard parts of their life are actually opportunities for personal growth, and to find a way that dealing with these things is actually making them a stronger person. And so we guide folks through this process of reappraisal to begin to shift the way they're thinking about the challenges in their life and to get more hope, coming back to that word hope. And that helps to alleviate the emotional pain and distress that's driving addiction. So we're doing that on the one hand, teaching people to alleviate emotional pain and physical pain through mindfulness. And we can talk about that if you're interested. But mindfulness has powerful effects on actually reducing physical pain. And so we're helping them to relieve the pain through mindfulness and reappraisal. And then we're teaching people how to fill fill the hole that's inside and to bring joy and meaning back to life, to rewire the brain's reward system with savoring. And so that's what makes this combination so powerful.
And a couple of quick thoughts, and I'd love to talk a little bit more about pain because I think it's really impactful and is such a driving force for addiction. But the CBT clinician in me, right, the cognitive behavioral therapist in me, like a lot of this resonates with even just the most basic CBT concepts of the cognitive triangle, right? So as clinicians, we get so focused on the thoughts part, which is super important and is part of this treatment too, right? Like we do lots of thought records, we do lots of cognitive distortions, like we do lots of those things, and that's very present in addiction treatment. But it's the other parts of the triangle that have this reciprocal relationship that are harder to access in clinical care. And I could see that accessing that kind of behavior and feeling piece of that savoring might really support those parts of the triangle differently so that you can actually shift your thoughts like that. It just makes so much sense to me. And we too often, I think, and this is why like there's so much more around somatic work and things that are helpful, because leading with thoughts is not always helpful. We will need to challenge those thoughts at some point, but let's get ourselves feeling better first, right? So have that be the doorway in. And I'd love to shift just for a few minutes about pain, because what I think would be really helpful to hear about is how how the more treatment really supports that experience of pain for folks. How does that change that? How does it actually reduce pain?
Yeah, let's talk about that. So, uh, and let's start by saying, with respect to opioid use disorder, opioid addiction, pain was one of the big drivers that pushed a lot of people into that problem to begin with. There was a pain crisis in this country, and then the medical solution at the time was to prescribe higher and higher doses of opioids, so OxyContin, Percocet, Vicodin, all that stuff, and that inadvertently led a lot of people down the path to addiction. But it started with a real legitimate pain problem, and chronic pain is super prevalent in the U.S. There's about 50 million American adults who have chronic pain, and some estimates say there's more chronic pain in our society than diabetes, heart disease, and cancer combined, which is incredible. You look around the room, you see six adults. I mean, you see. I'm gonna mess my math up. you you see six adults. One in those six has got chronic pain. So it's really pretty prevalent. So what do we do about it? And there's, unfortunately, there are not a lot of good medical solutions to chronic pain. Some treatments show some efficacy, but there's a lot of folks out there who have tried everything under the sun, from chiropractic to physical therapy to injections to back surgeries, and they're still in pain. And that's because one reason to that is because pain actually is operating through the brain and the nervous system. So mindfulness can really help alleviate pain, because it really doesn't matter where the pain is coming from. It could be arthritis in your knee, it could be you've got a blown out disc in your back, it could be you getting chronic daily headaches. Um, no matter where the source of the pain, all pain is in the brain. And what I mean by that is that the nerves are carrying the signal of damage up your spine and into your brain, and then that signal gets relayed through this part of the brain called the thalamus, which is like the brain's gatekeeper or relay station, and that sends that signal of damage out to your prefrontal cortex, which is the thinking part of the brain, and then it sends it to deep inside the brain to the limbic system, which is the feeling part of the brain, and that's where the conscious experience of pain is created. So if you can learn how to use mindfulness to change the way your mind functions, then you can change how your brain functions, and you can actually change your pain. You can literally reduce your pain. And we're doing that now in studies in my lab, really rigorous studies. We actually bring people in and we take a hot metal probe and we put that hot piece of metal against their leg. And this thing is super hot, it's like almost 120 degrees. You touch it and you're like, ow. And people can reduce their pain by about 30% on average just through practicing 15 minutes of mindfulness. Um, and actually, we did it to Sanjay Gupta, and he did great. He was able to drop his pain from like a 7 to a 2. It was incredible. And that's all because of how mindfulness actually works in the brain to change the way the brain is filtering the sensations from the body to actually turn down the volume of pain and make pain hurt less.
It was really interesting to hear the conversation and the training for more really just being like, you might have hurt your leg or you might have chronic back pain, but all of those signals come through your brain, right? And so just people will kind of like, oh yeah, well, that's true.
Yeah.
And it's like a good doorway into that understanding, which is hard for somebody who has had chronic pain for so long, because then there's so much focus and attention placed on pain, right? And in the kind of Buddhist principle of the second arrow, right? Like you're
Right.
constantly layering on suffering on top of the pain that just exists, and changing your relationship in your brain to that could do so much to, won't get rid of it completely, right? That's why we're not seeing 100%
That's right.
reduction, but we're seeing reduction, right? That make it much easier to go about your daily life. And then when you combine that, I think, with some of the savoring practices, so you have created more space by reducing the pain, and you can fill that space with enjoying other things,
That's right.
that it really probably has a compounded effect.
Exactly. And yeah, I don't want to discount people's experience of pain. It's really tough to live with pain, and there's no magic bullet out there. There's no panacea. If you've gone through major injury, you've got something really difficult going on in your body, and you can't just wave a magic wand and pretend like it's not there. But you can learn how to train your mind to change your brain, and to change therefore change the way your brain is actually experiencing the pain. And that, like you said, maybe it doesn't bring complete relief, but it does bring some relief, and that little bit of relief that you get could help you to live a more meaningful life. And we see on average that 15 minutes of the more mindfulness technique reduces pain by about 30%, which is the same amount of pain relief that you would get from 5 milligrams of Oxycontin. And that's pretty amazing. That's the average effect. But there are some people who can drop their pain by 50%. There are some people who could drop their pain by 100% while they're practicing mindfulness. Now, that doesn't mean that the pain's gone forever. Maybe it's only relief for the 10, 15, 20 minutes that you're practicing mindfulness. Um, then, you have to get up and start going about your day again. And maybe the pain comes back an hour later or 2 hours later. But, that the same thing could happen if you take a medication like ibuprofen. Take ibuprofen, it reduces your pain for about 3 or 4 hours. And then what do you have to do? You have to take another dose of medication. Well, maybe meditation is the same kind of thing. You meditate, it reduces your pain for a couple hours, and then pain comes back as you're going about your day, and you have to practice meditation again to get some more relief. But we're showing that if you do this kind of disciplined practice day in and day out, you can really get some sustained relief from pain and have a better life.
And it gives you some agency,
That's right.
right? Because pain can really be all consuming, and feel like you can't do anything about it. And that will contribute to significant depression. There's a lot of correlation to mood and to anxiety and to all of the other symptoms. But having some agency really can support all of that.
That's right.
And
That's so great.
agency gives you hope
And it gives you
Yeah.
hope.
that there's a
Back to
solution.
hope.
Back to hope. Full circle.
And you asked me, Jesse, what gives me hope? What's the frontier? So we have some new data from Moore, which is super exciting, showing that Moore actually grows the prefrontal cortex. That when you go through 8 weeks of Moore, not only does it change the way your brain functions, but it actually changes the structure of the brain. That people who go through the Moore program, their prefrontal cortex grows thicker, and that increase in thickness actually helps people to regulate their craving. So the more the prefrontal cortex grows through the mindfulness practice, the greater people are able to consciously reduce their craving. And I think that's just super exciting. So it comes back to that message of hope, which is that you can heal yourself from addiction, and that recovery is real, not only psychologically, but it's also real physically, that the brain is actually healing.
It's so cool that we have science to describe that. And it's not a small feat. So we really appreciate the work that you do, because it's not just conceptually, like, I think this sounds great. It's the science behind it, and the amount of work it takes to do trials that show that, and the amount of work it takes to figure out how can we measure that is an enormous amount of work. And so just appreciate your contribution to the field, because we really are changing the conversation about what's possible.
Well, thanks to you and to Spectrum for leading the charge here and helping us do this huge national study of Moore.
We're really excited. We're about to start some training. We've got some, I think I convinced Jesse at the beginning of this interview before you joined to become one of the trained clinicians.
I look forward to the training, Dr. Garland.
Great. I look forward to having you.
We now have we have actually already used this to recruit another clinician, and we do plan to share this with our teams to just share some more information, get people excited about this in the ways that Jesse and I are now excited about it, so that we can then share it with our patients and share that message of hope, so that we can be part of this evolving science. So we're really, really pleased to be part of it.
Beautiful. And for those listeners out there who are interested in getting trained in Moore, we do have a Moore training program. And so you could go to mooretherapy.com to learn more about that.
Great. We can add that to the show notes too, so folks are interested in being part of this conversation directly.
Well, thank you so much, Dr. Garland. This certainly was a pleasure for myself, and I know the listeners that are going to tune into this and really just not only get that sense of hope. I don't mean to keep going back to that word to overuse it, but yet another avenue that increases agency and gives people choices. We have choices today in recovery. Recovery is real. Thank you so much, Dr. Garland.
Thank you so very much. Thanks everyone to our listeners. Keep tuning in. We've got some great episodes coming up. Of course, everyone's favorite, some more episodes of folks with lived experience, but also some more research coming up and some more studies that we're involved in at Spectrum, so that we can share more of kind of the evidence base behind some of the work that's evolving over time in addiction. And so thank you so much, Dr. Garland. Look forward to continuing to work together. And maybe we'll have you back on kind of after this study with Spectrum was done, and we can talk about how it went and how much more we even learned.
I love it. Thanks so much, Lisa and Jesse.
Thanks, everyone. Bye now.